There's a question I need to ask you, and it might make you uncomfortable. Imagine sitting across from your physician tomorrow morning and they pull up your chart and say this: I can predict with reasonable accuracy which organ system in your body will start breaking down first after age 60. Would you want that information? Most people immediately say yes, and then they spend the next 10 years completely ignoring the very data that could change everything. Here's what fascinates me after 2 decades in clinical practice. There's one biological marker that's been sitting in your medical file since the day you were born. It's printed on an old insurance card, tucked away in a drawer, or buried in hospital records from decades ago, and it remains one of the most overlooked predictive tools we have for understanding how your body will age, how disease will likely manifest, and what specific systems are silently vulnerable right now. I'm talking about your ABO blood group. Not the pseudoscience version you see in diet fads, not the wellness blogger interpretation, but the version backed by large-scale longitudinal research involving hundreds of thousands of participants followed across decades, showing us that your blood type leaves biological fingerprints across your cardiovascular aging, your neurological resilience, your immune behavior under chronic stress, and statistically, what health crisis is most likely waiting for you if you don't act now. I'm Dr. James Whitemore, and I've spent over 20 years in preventive cardiology and metabolic medicine. Today we're walking through all 4 major blood types, O, A, B, and AB. For each one, I'm going to show you something that rarely gets mentioned during a standard office visit. Not because physicians are hiding it, but because there simply isn't time in a 12-minute appointment to make these connections for you. I'm making that time right now. But don't leave before the end, because there's a modifier attached to every blood type, something beyond just the letter, that dramatically shifts your individual risk landscape, and most people never consider it even once. Before we go further, do me a favor. Drop your blood type in the comments right now, O, AB, or AB. Knowing yours will make everything I'm about to explain directly applicable to your life. Let's begin with type O. And I want to reframe this completely from what you've probably heard elsewhere. Type O dominates the global population. Around 45% of humans carry it, and for most of our evolutionary history, that likely represented a powerful survival edge. Type O blood seems to have originated in our earliest ancestors, populations shaped by environments demanding endurance, aggressive immune defenses against parasitic threats, and digestive systems designed to handle high-protein intake under physically demanding conditions. Now here's what that ancient genetic architecture looks like inside a contemporary human body past 60. Cardiovascular-wise, type O individuals naturally maintain lower circulating levels of von Willebrand factor, a clotting protein. Lower clotting factor means smoother circulation, reduced platelet stickiness, and statistically fewer arterial obstructions that trigger myocardial infarctions and ischemic cerebrovascular events. Numerous large cohort studies confirm that type O individuals demonstrate significantly reduced coronary artery disease risk compared to type A, B, and AB populations. That's legitimately excellent news. But here's the part nobody discusses with type O men and women past 50. That cardiovascular protection can create a dangerous false sense of security. I've witnessed this scenario repeatedly. A type O patient in their late 50s walks in. Blood pressure looks solid. Lipid panel is reasonable. No cardiac disease in the family tree. And because they feel biologically shielded, they stop monitoring the systems quietly deteriorating elsewhere. They dismiss chronic exhaustion. They ignore gastrointestinal disturbances. They power through escalating joint inflammation, because type O's most dangerous age-related weaknesses don't originate in the heart. They emerge from the digestive tract. The gastric lining in type O individuals expresses cellular receptors that Helicobacter pylori, a particularly aggressive bacterium, attaches to far more easily than in any other blood group. H. pylori doesn't present dramatically. It doesn't trigger acute severe pain in most cases. It colonizes silently, establishing itself in the stomach's mucosal layer, and across years, sometimes decades, it systematically dismantles the protective gastric barrier. Left unidentified, this progression moves from chronic gastritis to duodenal ulcers to, in a substantial percentage of cases, gastric malignancy. And stomach cancer detected late carries one of the poorest survival outcomes across all cancer types. There's more. Type O individuals demonstrate measurably higher rates of peptic ulcer complications requiring surgical intervention compared to other blood groups. This isn't theoretical, it's documented across multiple international studies. So if you're type O, over 55, and you've never been screened for H. pylori, that's the single most critical preventive conversation you need to have with your doctor this quarter. It's a straightforward stool antigen test or urea breath test. It's inexpensive. And for type O individuals, this isn't routine screening. This is precision prevention based directly on your genetic vulnerability. Here's your type O longevity blueprint. Your gastrointestinal system is your Achilles heel. Defend it proactively and relentlessly. That means minimizing chronic use of NSAIDs like ibuprofen and naproxen unless medically essential. These medications degrade gastric mucosa in everyone. In type O individuals, they're assaulting tissue already operating at elevated biological risk. Integrate cultured foods into your regular diet. Kefir, sauerkraut, kimchi, naturally fermented vegetables. These aren't wellness trends for type O. They're functional tools for maintaining a gastric microbiome that resists pathogenic colonization, and physically, your body was engineered for consistent movement. Type O blood correlates with elevated baseline catecholamine production, meaning your nervous system generates higher dopamine and norepinephrine output than other blood types. When that neurochemical drive has no kinetic release, it converts into agitation, fragmented sleep, and eventually cortisol dysregulation. 30 minutes of daily walking plus 2 weekly resistance sessions will contribute more to your long-term metabolic stability than any supplement protocol on the market. Type O. Cardiovascular resilience is your genetic gift. Your stomach is your lifelong responsibility. Don't let one make you careless about the other. Before I continue, tell me your name and where you're watching from. I read every single comment, and I genuinely want to know who I'm speaking to today. Now, type A, and I need your complete attention here because this is the blood group where the gap between what people understand and what they desperately need to understand is the most extreme. Type A appeared as human civilization shifted toward agrarian lifestyles, denser population centers, increasingly complex social structures, and broader infectious disease exposure. The immune system evolved accordingly. Type A individuals generate powerful and highly effective immune reactions, especially against viral infections. In earlier life, that represents a genuine biological advantage. But here's where the blood type narrative becomes complex, because what protects you in your 30s and 40s begins turning against you in profoundly different ways by your 60s. Type A blood demonstrates elevated coagulation potential. The platelets are inherently stickier. The clotting cascade activates more readily. A landmark Harvard cohort study following over 800,000 adults across 2 decades revealed that type A individuals carry approximately 5% higher coronary heart disease risk compared to type O. That percentage might sound modest in isolation, but here's what makes it clinically devastating for type A specifically. When you overlay chronically elevated cortisol on top of that inherently stickier platelet biology, the compounding effect across decades transforms a 5% statistical variance into an actual cardiac event. The danger isn't just in the baseline number, it's in what your stress physiology does to that number every single day for years. Now here's the dimension most analyses completely overlook. The reason that risk becomes so clinically significant isn't purely mechanical, it's neuroendocrine. Type A individuals sustain the highest resting cortisol concentrations of any blood group. Cortisol is your primary stress hormone, and in acute bursts, it serves a purpose. It enhances cognitive clarity, mobilizes energy substrates, prepares your physiology to handle immediate threats. But when cortisol remains chronically elevated, day after day, week after week, it executes something very specific to your vascular integrity. It inflames and rigidifies the endothelium, the delicate cellular layer lining your arterial walls. And here's the mechanistic cascade that should deeply concern every type A man or woman watching this. When your endothelium becomes inflamed and loses elasticity, it transforms into a surface that those already sticky platelets preferentially bind to. The elevated clotting activity inherent to type A blood and the chronic cortisol-driven endothelial damage characteristic of type A physiology aren't two independent risk variables. They're a compounding biological loop. Each one amplifies the danger of the other. What this means practically is that for type A individuals, stress regulation isn't a lifestyle preference, it's direct cardiovascular intervention. It belongs in the exact same category as antihypertensive therapy and statin management because physiologically, it's targeting the identical underlying pathology. If you're type A and past 55, monitoring your blood pressure every 6 months instead of annually isn't excessive caution. It's appropriate clinical surveillance for your specific biology. Request that your physician include homocysteine in your next metabolic panel. Homocysteine is an amino acid that, when chronically elevated, directly damages arterial endothelium. Type A individuals trend toward higher homocysteine concentrations, and the intervention is remarkably straightforward. Adequate folate, B12, and B6, naturally abundant in dark leafy vegetables, eggs, legumes, and lean animal proteins. This isn't costly or complex, but it's targeted specifically to your vulnerability and establish a daily cortisol regulation ritual, not an occasional weekend meditation retreat, not sporadic breathing exercises, something you execute every single morning before your day demands anything from you. Diaphragmatic breathing, 4 seconds inhalation, 6 seconds exhalation, practiced for 10 minutes consistently, produces measurable cortisol modulation in controlled clinical trials. The consistency matters infinitely more than the duration. 5 minutes every morning outperforms an hour on Sundays by a significant physiological margin. Type A, extraordinary immune defense capability. Elevated cardiovascular risk driven by a stress hormone, your blood type keeps perpetually elevated. Managing that hormone is the single most important health decision you'll make this decade. If you're still here and finding this valuable, just type A in the comments. It shows me you're engaged and helps me understand what's resonating with you. Type B. The blood group conventional medicine understands least effectively and mainstream wellness handles most poorly. Type B emerged among nomadic populations migrating across Central Asia's vast interior and the Himalayan regions. These were cultures constantly adapting to shifting food sources, variable climates, and novel infectious challenges. The resulting immune architecture is genuinely exceptional in its metabolic versatility. Type B individuals process diverse proteins, fats, and carbohydrate sources efficiently without the inflammatory resistance other blood types sometimes generate when exposed to dietary variation. That adaptability is authentic, and in evolutionary context, it represented an extraordinary survival advantage. But here's the clinical challenge most Type B individuals past 55 are carrying unknowingly. Type B demonstrates a distinct and not fully understood immune signaling architecture. What research consistently reveals is that Type B individuals appear to possess a broadly adaptive immune response, one that processes varied dietary and environmental inputs differently than other blood groups. Studies confirm Type B individuals maintain measurably distinct gut microbiome compositions, and certain inflammatory dietary triggers, refined seed oils, ultra-processed foods, high fructose corn syrup, appear to generate stronger systemic inflammatory cascades in Type B compared to other blood types. The autoimmune landscape across blood groups remains actively researched, and findings remain complex. What's clinically clear is that maintaining your inflammatory baseline low through nutrition, movement, and regular CRP monitoring represents the most evidence-supported protocol for Type B longevity. If you're Type B and have been managing these symptoms through lifestyle modifications alone, dismissing them as merely aging, it warrants a direct conversation with your physician regarding autoimmune screening. Early autoimmune detection transforms treatment trajectories dramatically. There's a second issue specific to contemporary life for Type B individuals. The modern industrial food system represents a calibration crisis for your immune architecture. Refined seed oils, ultra-processed foods, high fructose corn syrup don't merely represent nutritional emptiness. For Type B individuals, research indicates these inputs function as particularly potent triggers of systemic subclinical inflammation, the type that operates below symptomatic thresholds for years while progressively distorting immune precision. Your C-reactive protein concentration, a standard inflammatory biomarker available on routine blood panels, should be monitored at minimum annually. A consistent CRP reading exceeding 1 milligram per liter without obvious acute infection represents a meaningful signal. It indicates your immune system is operating in chronically activated mode, and you need to identify the trigger before it identifies you. For physical activity, Type B physiology responds optimally to sustained moderate-intensity movement rather than repeated high-intensity intervals. Cycling, swimming, hiking, and consistent walking protect your inflammatory baseline far more effectively than interval protocols that generate sharp inflammatory marker spikes during recovery periods. Type B, the most metabolically versatile blood type on Earth. Maintain your immune system precisely calibrated, and it's among your greatest assets. Allow it to operate unchecked, and it becomes among your most serious vulnerabilities. Before I transition to the final section, if this is helping you connect how your body might be responding to what you consume and how you live, do me a small favor and tap the like button. It helps this kind of research-grounded practical information reach more people quietly struggling with fatigue, inflammation, or health issues they can't fully explain. And tell me in the comments, have you ever been told you might have an autoimmune condition, or has it always been dismissed as normal aging? I read every comment, and I'm genuinely curious how frequently this gets missed or overlooked. Type AB is the youngest blood group in human evolutionary history. It appeared relatively recently when populations carrying type A and type B antigens began intermixing at scale. And because of that dual genetic inheritance, it carries a genuinely unusual immunological profile. On one dimension, type AB inherited immune tolerance characteristics from both ancestral types. AB individuals demonstrate reduced inflammatory responses to certain environmental antigens, translating into meaningfully lower risk of specific gastrointestinal malignancies and certain gastric pathologies compared to other blood groups. But here's where I need your absolute focus, because what type AB gained in immune tolerance came at a neurological cost the research has made increasingly impossible to ignore. Type AB individuals carry statistically elevated cognitive decline risk, including vascular dementia, compared to type O individuals. The mechanism is cerebrovascular. Type AB blood maintains elevated coagulation factors inherited from its A lineage, combined with the cardiovascular complexity of the AB antigen profile. Across decades, this creates subtle but cumulative alterations in cerebral blood flow through the brain's smallest capillaries, the microvascular networks servicing regions most critical for memory consolidation, processing velocity, and executive function. These aren't dramatic obstructions, they're microscopic progressive changes in perfusion efficiency across neural tissue that most individuals wouldn't detect until cumulative damage has been accumulating for 15 or 20 years. This is why, for type AB individuals, cardiovascular health and cognitive health aren't separate discussions. They're identical. Blood pressure control, glucose regulation, lipid and triglyceride management. Every intervention protecting your arterial integrity is simultaneously protecting your cognitive longevity. DHA, the long-chain omega-3 fatty acid abundant in fatty fish like salmon, sardines, and mackerel, integrates directly into neuronal cell membranes. It preserves membrane fluidity and reduces neuroinflammatory signaling that accelerates small vessel cerebrovascular disease. 2 servings of fatty fish weekly, or a pharmaceutical-grade fish oil supplement discussed with your physician, isn't optional supplementation for type AB individuals. It's targeted neuroprotection based specifically on your biology. Sleep is the other non-negotiable variable. During deep sleep, your brain's glymphatic system, its internal metabolic waste clearance network, removes accumulated metabolic debris, including amyloid proteins associated with neurodegeneration. Consistently sleeping under 6 hours meaningfully impairs this clearance process. For type AB individuals, chronic sleep restriction isn't merely fatigue, it's accelerating the precise biological process your blood type already renders you more vulnerable to. 7 to 8 hours nightly. This is your most powerful daily intervention. Type AB, impressive immune tolerance, a brain requiring deliberate, consistent, long-term protection starting now, not at 70. If you're still with me and this is resonating, just type "it helped" in the comments. I genuinely read them, and it shows me what's landing with you, the RH factor. Before we close, there's one additional variable almost nobody incorporates into these discussions, and it matters significantly. That plus or minus symbol at the end of your blood type designation. RH positive or RH negative. Approximately 85% of people are RH positive, meaning they express the Rh antigen on red blood cell surfaces. The remaining 15% are Rh negative, and this distinction isn't cosmetically trivial. Rh negative individuals appear to carry a modestly different cytokine signaling profile, meaning the chemical communication language your immune system employs is calibrated differently. Research is still establishing complete clinical significance, but emerging evidence suggests Rh negative individuals may demonstrate heightened sensitivity to certain inflammatory triggers, which means regardless of your primary blood type letter, if you're Rh negative and manage any chronic inflammatory condition, the anti-inflammatory protocols I've outlined today become even more critical and should be implemented more rigorously. For women who are Rh negative, if you're pregnant or planning pregnancy and your partner or infant may be Rh positive, this is a medically critical conversation requiring immediate discussion with your obstetrician. Rh incompatibility during pregnancy is entirely manageable with appropriate medical intervention. It requires that intervention, and it requires it proactively. Know your complete blood type, the letter and the sign. Ensure your physician has both documented. Now here's the most crucial statement I'm making today, and it's what most blood type content completely avoids. The statistics are legitimate, the risk elevations are documented, the biological mechanisms are genuinely significant, and they are not your destiny. I've witnessed type AB patients in their mid-70s with sharper cognitive performance than colleagues 15 years younger, not because their genetic risk profile was somehow different, because they understood what their biology was working against, and they structured their daily existence around addressing it. They maintained 8 hours of sleep, they consumed 2 servings of fatty fish weekly, they kept blood pressure consistently below 120/80, not just occasionally. They engaged in genuinely challenging new learning, real cognitive engagement, not passive scrolling. Their risk remained present. The statistical profile still applied. They simply chose to confront it directly rather than allow it to accumulate silently in the background. The distance between genetic predisposition and actual health outcome isn't small. It's enormous, and it's occupied entirely by decisions made consistently across years. That space is where your choices exist. Your blood type isn't a verdict, it's a blueprint, and a blueprint only holds value if you're willing to examine it. Now tell me something, what's your blood type? And does the profile I described today align with what you've actually been experiencing in your own health across recent years? Drop it in the comments. I read every single one, and what surfaces consistently in this community determines the topics I address next. If you found this valuable, there's another video linked in the description where I examine the 3 most commonly overlooked root causes of persistent fatigue and elevated blood pressure in men and women past 55. Conditions that are addressable when identified early and almost always mismanaged when they're not. Take exceptional care of yourself. You've carried this body a long time. It deserves you understanding precisely how it functions.